Today I want to talk about the impacts of fear on birthing physiology. If you've not already watched my 30-minute clip on birthing physiology and the role that oxytocin plays, I want to encourage you to watch that first because then you'll get a more broader picture, a better understanding of what I'm getting at when I talk about the impacts of fear on our physiology and why it's so important to understand, how these fears impact our physiology in terms of a reduction in oxytocin production. If you watch that other video first, you'll understand this better. Okay, so fear. I'm going to talk this morning about, yes, how that impacts the physiology, also what the sources of fear are, and how this leads to things like how fear leads to things like failure to progress in labour, struggles with bonding with our newborn, how it impacts the degree of pain we experience in labour, how it can impact us getting exhausted in labour. Because these are common kind of side effects, if you want to refer to it that way, of having too much fear in labour. And actually that's a good place to start, is to just point out that it is perfectly reasonable to go into your birth with some degree of fear, right? Like birth is unpredictable. There's a lot of unknowns about birth. And so it is natural that when we are entering into something that carries with it unknowns, that there is going to be some degree of fear. It's a really, really precious and important experience in our lives and in the life of our baby and our family. So, of course, it holds a lot of weight. Therefore, there is going to be potentially some fear around some what ifs that might be playing out in our minds. That's normal. Some degree of fear is totally to be expected. But when we have an exaggerated sense of fear around our birth experiences, it can be really, really unhelpful. And for most of us in our over-medicalised birth culture, we are actually encouraged, perhaps not in quite such covert ways, but we are encouraged to view birth as dangerous and to be fearful of our birthing bodies. Which is, really, really unfortunate and really not okay, actually, because it leads to a lot of needless interventions and a lot of needless birth trauma. Okay, so what happens in terms of our physiology when we have too much fear in birth? Well, to explain this, I like to sort of talk about imagining that you're birthing during Stone Age times, right? You're labouring away in your cave and everything is progressing beautifully. And suddenly there appears at the entrance to your cave a saber-toothed tiger. Now that is going to flood your body with fear. And your body is going to read that fear as, okay, it's a dangerous time to birth a very helpless little infant. So the body responds by reducing your oxytocin flow because it wants to inhibit the amount of contractions you're having. It's not very helpful to be having contractions when you are needing to fight off the danger or run away from it. So your body will reduce your oxytocin that's being produced and instead will flood your body with adrenaline. And that adrenaline will help prime you to fight or flee from the danger. It will put you into your sympathetic nervous system state, your fight or flight state. And this is to either fight off that danger, kill that tiger, or to run to safety. So that adrenaline will cause your heart rate to increase, it will cause your breathing rate to go up, it will shunt blood away from non-vital organs to your heart and lungs and to your muscles, so that you are really well primed to be able to fight off that danger, or to run and find safety. And once you've done one of those things, once you've either killed the tiger, or you've run and escaped and found a safe space again, then you'll start to resume some calm in your body. Your adrenaline will leave your system, your oxytocin tap will turn back on again, your labour will resume, you birth your baby. Actually, interestingly, if that saber-toothed tiger was to appear at the entrance of the cave when you're already beginning the pushing sort of phase of your labour, it will have a different effect. It won't try and your body will have that respond differently. Your sympathetic nervous system will kick in, but the physiology won't stop your contractions from happening, won't try and stop your labour, because it's like you can't, you're too far progressed, you can't stop your labour. What's most helpful is to get the baby born as quickly as possible so that you can pick it up and run. So that's when we get this, what's termed the fetal ejection reflex happening. The rush of adrenaline causes the baby to be born very, very rapidly, so that, like I say, you can pick it up and run to safety. Of course, in modern day times, we don't have saber-toothed tigers, but our bodies at their primal core level will still respond to other fears as being like that saber-toothed tiger, as reading your fear that you're feeling as, okay, we're not in a safe space in which to birth a helpless little infant, so the body is trying to protect you and your baby by slowing your labour down, stopping your labour, causing you to enter the fight or flight state. And yeah, the body doesn't know that you can't fight off or necessarily run from the dangers, the fear, the things that you're fearing, in modern day birth. Okay, but it will still respond in the same way. So if we think about what sort of things we might be fearful of in modern day birthing, well, we're really primed to view birth as scary and dangerous from the get-go. If we think about the media portrayals, the ways that the media portrays birth, that if you are watching a drama, somebody's giving birth in the program, they are very frequently in the hospital on their back, legs in stirrups, with doctors with all gowned up, telling them to push, and there's lots of, very like screaming and, it's very dramatic. Just the very fact that birth is very rarely depicted as taking place outside of the hospital, and indeed, in Western society, very rarely does birth take place outside of the hospital, is a sign in and of itself that we've been raised to believe that birth is inherently dangerous and requires medical attention. So there is, I don't want to go into that in too much depth, but there is a lot of conditioning that sets us up to believe that birth is inherently unsafe, and that hospital is the safest place to be, and under expert care is the most responsible and appropriate and safest way to bring our babies into the world. The data doesn't agree with this. The research does not concur. So if we compare research done on well women who are pregnant who are planning to birth their babies in hospital versus well women who are pregnant who are planning to birth their babies at home or in a primary birthing unit, the statistics are very similar in terms of maternal and infant morbidity and mortality rates, but what is significantly different is that those planning to birth in hospital have much higher rates of interventions, and they have lower rates of maternal satisfaction around their birth experiences that when compared with those who are planning to birth at home or in a primary birthing centre. Yeah, that's another episode to go into. But there is a lot of fear around birth. And yeah, most of us need to do quite a lot of unlearning, unpacking our conditioning, really exploring where our beliefs have come from around birth and safety in birth and who's responsible for what when it comes to birth, in order to set ourselves up to have have perspective, have good perspective when it comes to the time of birth, because like I said, if we have too much fear, that is unhelpful with the progress of our labour. A small amount of fear, different story. Okay, so what do I want to say next? Yeah, so if we think about the saber-toothed tiger kind of scenario, right? Like where when the body is sensing a danger in our environment, it will slow our labour down. It will reduce the amount of oxytocin that's being produced, and it will put us into a state of fight or flight. So what does that look like in modern day birthing? Somebody enters the hospital, they've been labouring away at home, perhaps feeling quite good about how their labour is progressing at home, but now they've come into the hospital and it's a new space and there's new smells and it's somebody else's turf, and they might be able to hear other labouring women, and that could sound scary, or and they enter the birth room and there's all this equipment and these odd smells and maybe bright lights, a very sort of clinical, sterile looking space that is, it doesn't have the comforts that the home environment had. You don't feel as at ease and as comfortable as you did in your home space for obvious reasons. And so that in and of itself could be enough to cause us to feel unsafe, and for our labours to slow down for a time. And this is a really, really common response to that initial transition into hospital. But if we have really good support and we feel more at ease being in the hospital, and perhaps, we've got the lights dimmed, maybe we have access to a pool in our birthing room and we can climb into that hot water, or if we're well supported, our labour may then resume. We're feeling safe, it's good, that oxytocin comes on stronger again, and labour progresses as it should. But maybe that's not our experience. Maybe we continue to feel unsafe. Maybe we feel pressured to have certain interventions because now there are there's more machinery in our space, there's more access to equipment and machinery and drugs. There's more medical personnel who perhaps have less trust in birthing physiology and think that you indeed need them and their expertise and their equipment in order for your labour to progress safely. But yeah, there's a lot that plays into a lack of a sense of safety and trust in their process for people who, enter the system, who are, within that kind of medical arena. And yes, again, I feel like I could unpack this for half an hour. I'm not going to do that. I'm going to talk about what's going to happen in the body if we continue to feel unsafe and our body stays in that fight or flight mode. So yeah, if we're in fight or flight and we don't have good access to our oxytocin flow, then our labour is going to not progress, right? Like we need oxytocin to get our bodies opening, getting to move our babies down and into a good position and to be born. So if we're not producing enough of this oxytocin, then our labour is going to slow down. Sometimes it will stop completely, but often for people it will just slow down. The contractions won't increase in length and strength and frequency. If the cervix is being checked for dilation, which is almost inevitable in the hospital system. It's not, always that people have vaginal exams in hospital, depending on who they have as their care providers and what education they've had antenatally, or discussions they've had with their team or whatever. But the vast majority of people who give birth in the hospital are going to have usually multiple vaginal exams in their labours. So if their cervix is being checked, it may be that they are not dilating any further. Perhaps they're not their cervix is stuck at 5 centimetres for a number of hours, or it's just incredibly slow to open, or maybe sometimes it even closes up, right? Like our bodies don't want to birth our babies. They don't want to let our babies out if we are feeling unsafe. It is a protective mechanism. It is to help us. Our bodies are not failing us when they are not progressing. They are sending us a signal that we are not safe, we're not in a safe space, and so now is not a safe time to give birth. So yeah, we will often be labelled as failing to progress if our bodies are doing this thing of trying to protect us and our babies. That failure to progress is then met within the medical arena with okay, we're on the clock, we need to get things moving, so we're going to speed your labour up with some synthetic oxytocin, some intravenous synthetic oxytocin, which goes by the name of Pitocin in the States, or Syntocin in New Zealand and other parts of the world. And that forces the contractions to keep happening. It also has lots of potentially harmful and dangerous side effects, and it doesn't have the helpful effects on the brain that beautiful naturally produced oxytocin does, that I talked about in the other video. I will compare, in greater depth in another video, synthetic oxytocin versus endogenous or natural oxytocin another time. But yeah, your labour, you'll be encouraged to, I say encourage, it's sometimes literally, like pressured, bullied, coerced into having your labour sped up with synthetic oxytocin, and that will likely cause a cascade of further interventions, further complications. So that failure to progress more accurately should be termed either failure to be patient or, I think more so, a failure to recognise that this labouring woman doesn't feel safe. How can we support her to feel safer? What is she needing in order to access those helpful hormones, get those helpful hormones flowing, her oxytocin, her endorphins. What does she need to feel safe? Yes, if only. Another reason for another impact of too much fear, lack of oxytocin in birth is, and this, I see this a lot in women who have their labours either sped up with synthetic oxytocin or induced with synthetic oxytocin, is that if at the time of birth you either don't have access to your endogenous oxytocin, the stuff you produce in your brain, because you are in a state of fight or flight, because you are in a state of trauma at the time of birth, and your birth has been kind of forced with this synthetic oxytocin, then at the moment that you meet your baby, when you would naturally, if you'd had a physiological birth, if you hadn't had those interventions, if you weren't experiencing birth as traumatic, you would have had a massive hit of a massive flood of oxytocin into your body at the time of birth, which primes you to fall in love with your baby, which primes you to feel bonded with and connected to your baby. Perhaps not instantly the moment they're born. Sometimes this takes like a couple of minutes even for the mum to like come to, but it's there. That bond is pretty instant for most people who have a physiological birth. They do feel connected to their baby. They do feel an overwhelming urge to love on and nurture their newborn and protect their newborn. But a lot of people who I work with who have experienced birth as traumatic, who have had induced labours, who have had a host of interventions, do not have access to that endogenous oxytocin flood at the time of birth, and they do not feel bonded to their newborn. A lot of women who I work with describe the moment when they first received their baby as they felt numb, or they felt nothing. They felt like it wasn't their baby, like they just wanted somebody to take the baby away, and they can feel an incredible guilt and shame around that. But again, this is a normal response to what is happening in that moment. When we're in a state of trauma, our body is like focusing on survival. It's not focusing on falling in love with our newborns. And when we don't have that flood of oxytocin to help us to bond with and connect with our babies, then we are really, really on the back foot in terms of developing that connection. It's not to say it can't happen with time. And, Sarah Buckley talks about ways we can fill the hormonal gaps that are present for many people at the time of birth. And we can talk about this in another video as well. But struggling to bond with our newborn is a normal response to a traumatic birth. As well, when we have lots of fear in our birth, it will typically increase our physical sensation of pain. There's this thing, the fear, tension, pain cycle, where the more fear we have, the more tension we have in our bodies, the more pain we experience. And the more pain we experience, the more scared we become, the more tension there is in the body, the more pain we experience. So there's this kind of snowballing effect. Coming back to, again, that synthetic oxytocin that's given intravenously, it can't cross the blood-brain barrier to reach our brain. So unlike the oxytocin we would naturally produce during a physiological birth, that as it increases in amount, we start to produce these endorphins, which help us to cope with the pain of labour. With intravenous oxytocin, we're not stimulating the release of those endorphins, so we don't have access to those helpful painkiller effects of the endorphins. As well, we are likely, so we're going to have a more painful labour, we're likely to have a longer labour. It's going to be slower to progress if we've got lots of fear there, for the reasons I talked about before. So we are likely to get more exhausted and lose faith in ourselves to be able to continue to tolerate this for too much longer, and therefore we are more likely to going to end up needing an epidural to get a rest and refine that energy and belief that we can actually get this baby born. So yes, too much fear has very real impacts on our physiology, on our ability to birth our babies in safe and efficient and rewarding ways that we are innately primed to do when we trust our physiology, when we listen to our bodies, when we are supported to access that physiology, when we are supported by people who trust our ability to birth and do the things, say the things that help us to continue to produce our awesome oxytocin and endorphins and these things that really, they're there. Everything we need is already within us. It's fear, and that comes in its multiple forms, that inhibits us from accessing our helpful hormones and our instinctive behaviours. We're women, we're animals, we know how to birth babies. Of course we know how to birth our babies. So it's about kind of learning what we need to learn and unlearning what we need to unlearn in order to just really sink into trust, to minimise the amount of fear that we have around birth. Because when we trust that we know how to birth our babies without outside interference, then we are naturally going to have minimal fear, right? And therefore we are going to be able to, for the most part, of course there's always exceptions, we're going to be able to just get on and birth our babies the way that we're designed to.